The FDA reports many Black and Hispanic Americans have been getting vaccinated against COVID-19 at lower rates than white Americans, but are more likely to contract COVID-19, be hospitalized, and die from the disease. To talk more about the racial disparities as health officials work to get more people vaccinated, we bring in our ABC-7 at 4 medical contributor, Dr. Neha Sharmas. She's medical director of the hospitals of Providence, Northeast, and Horizon City. Dr. Sharma, last month the CDC director declared racism a serious public health threat. So what does that mean for us?
It's a very important step. But racism has been a public health crisis. It's always been a public health crisis. It's not, it is actually a reality that people of color confront on a daily basis, not just apparent in the police brutality that disproportionately claims the lives of Black Americans or the anti-Asian hate crimes that are so rampant right now, but it is also apparent in the legacy of slavery and discrimination that persist in countless social determinants of health.
And there are racial disparities in healthcare, right?
Yes, and they've existed for generations. The rate of chronic disease, poverty, infant mortality, and premature death is higher in Black and people of color and racial and ethnic minorities in the US than whites. But it's not a universal pattern. For example, Hispanic immigrants have better health outcomes than whites, but this immigrant paradox actually appears to diminish with time spent in the United States. Now, let's look at the COVID-19 pandemic. It further illuminates the epidemic of racism in our country. The startling death rate of Black Americans because of COVID-19 further actually reveals the persistent inequities and the urgent need for solutions.
Dr. Sharma, what do you think are some of the contributing factors?
As physicians, we're trained to cite poverty, lack of access to care, poor education, and possible explanations for racial disparities. But no, we need to recognize the impact of racism, especially structural racism and the centuries of barriers that were intentionally placed in the way of Black Americans that created these disparities to begin with. Only then we can narrow the gap.
So in your view, how do we fix this?
Very complicated question, Mark, has so many layers, but the declaration is definitely a step in the right direction. As physicians, how do we fix this or contribute to the fix? I think as physicians, we need to fight racism by recognizing, understanding, and acknowledging the racist attitudes and actions. We also need to openly identify our implicit biases, also manage bigotry safely, learn from it, educate others. And I also want to mention that physicians of color themselves are targets sometimes of racism and bias. So all these aspects need to be included in the dialogue for change. Only then people of color can reach their full health potential.
ABC-7 at 4 medical contributor Dr. Neha Sharma, thanks for your insight today.
Thank you.